Hey guys, it's Wynn, your friendly neighborhood pelvic floor physical therapist, and I wanted to talk to you today about pelvic floor physical therapy. So most people don't realize that there is physical therapy for pelvic floor issues. So if you're here, you either went to your doctor and they told you to go try pelvic floor therapy and you're not quite sure about that, or you have some pelvic floor issues and you're looking for a way to get better. I am a physical therapist, but I have done extra specialized training in pelvic floor conditions and treatments. So today we are going to talk about what some of those conditions are and exactly what's involved with treatment. So conditions that I often see are incontinence, leaking pee when you laugh or cough or sneeze, or leaking on your way to the bathroom. I also can treat overactive bladder, so going too often. I can treat a lot of digestive issues, so constipation or diarrhea, or if you have both. And I see a lot of people for pain. Now, pelvic pain is a little different. Our body is kind of programmed to not pay attention to our pelvic floor. So when there's a problem, your symptoms are going to be somewhere else. So usually what I am seeing is pain in the hips or back, or even the belly. But often can be traced back to the pelvic floor. I have a couple of other videos on some of those conditions specifically, or if you're just interested in more kind of general information about the pelvic floor, I have a video for that too, so go ahead and check that out. All the things that I just talked about are very treatable with physical therapy and respond really well to the things that we do in physical therapy. But I'm sure you're a little worried about what would be involved if you came in for therapy, so that's what we're going to talk about next. The first thing we're going to do is talk a lot. So we will talk about the symptom that you came in for, but then we're also going to talk about a lot of other stuff. So I'm going to ask you a whole bunch of questions about your bladder function, your bowel function. We're going to talk about if you have pain in your back or your hips. We're going to talk about if you have headaches or neck pain, heartburn, shortness of breath, anything like that, because those can all be related to pelvic floor dysfunction. And when I know what's going on with you, if I get a good complete picture, then I know where I need to go for my exam. When we do the exam, we're going to be looking at your muscles and your joints. So just like if you've been in physical therapy before, I'm going to check the strength and flexibility of a bunch of different muscle groups around your hips, your back, your belly, to see how they're working, because that can also give me an idea of how your pelvic floor might be functioning. So then we need to check the pelvic floor muscles. So pelvic floor muscles are just like any other muscle in your body. They can get weak or they can get tight or both. So just like, your neck muscles can get tight and irritated, they can too, but it's a little harder to tell if they're tight and irritated. So we can check the muscles over your pants, kind of feeling right by your sit bone there. I can check to see if those muscles are turning on or if they're a little sore. If we need to, we can check them internally, which definitely gets a little bit more personal, but it is in a private room. I don't have a speculum. I don't have stirrups. Most people tell me it's a lot easier even than getting their PAP. So if we do decide that we need to check your pelvic floor muscles a little bit more closely, that is up to you. If you don't want to do it, we don't do it. There are lots of exercises and stretches we can do to try to make things better if you choose not to do the internal assessment. Once we know what's going on with your pelvic floor, then we can design your program. So it's definitely going to involve exercise. Most of the exercises I do are going to incorporate breathing. With the pelvic floor and the core in general, the strength of the muscles is not quite as important as the coordination of the muscles. So the exercises we do are going to be difficult, but not like if I asked you to do 100 sit-ups, more like this kind of difficult, right? It's more dealing with the coordination of the muscles. So it's kind of getting everybody working together as a team again. And we're usually quite successful with all the things we talked about, the incontinence, back pain, pelvic pain, things like that. If with all of this you have decided, you know what, I need a pelvic floor tune-up, then come in and see me. So to do that, depending on your insurance, for most insurances, you're going to need a prescription from your doctor. Let them know you think you have a problem and you want to see me, and they'll write you a script and then send that right over here to Thunder Bay Therapy and Sports Medicine. The really good news is pelvic floor stuff tends to get better really fast, which is part of why I like treating pelvic floor patients. So it's nice when people get better really fast. So generally, we would see you once or twice a week, depending on, what your symptoms were and how fast you wanted to get better. And a lot of times it's only 3 or 4 weeks that people need to come in for therapy. So if you have questions, you can email me. I'll put it right down here at the bottom of the screen, or you can call the clinic. I'm at Thunder Bay Therapy and Sports Medicine, and our number is 358-8086. Thanks for watching.